everybody. It's 4:56. The date is October 25th, 2021. First day of the surgery rotation. And I'm pretty excited. I'm gonna go ahead and get dressed, go hit the office, and see what's on the schedule for today. Guys, all dressed. Got my Crocs, got my UF Medicine fanny pack, and pretty much dressed for success this morning. I will be reviewing this Best Suture Techniques in Training video from Duke University, compliments of my friend Peter. I set up my kit the night before. Here's my breakfast. Red Bull gives you wings. I also eat a 350 calorie fat bar, I call it, because omega-3 fatty acids are the way to go in the morning. Here is my extended release methylphenidate for attention and focus, which I have been prescribed by a licensed psychiatrist, which I recommend you do too if you are lucky enough to have attention deficit hyperactivity disorder. Here's my room. It's kind of a mess. I've been working on that. I like to hang stuff because I know where it is that way. Here's my calendar. Also working on that. All right, guys, I got to start focus now. The time's 4:58. Orientation starts at 7, so I only have really an hour to get into this video. So I'll catch you guys on the flip side.
Full buried suture. This will be the main suture you'll use when putting some...
Yo, you want to be in my documentary? Just come introduce yourself right here. I'm doing a whole documentary on surgery.
It's an honor to be a part of the documentary.
Well, introduce yourself, name and stuff like that.
Name is Matthew Jordan Goldman. I am another fellow third-year medical student, aspiring neurologist, and interested and advocate for those in pain, like Jesse, Karen here. And excited to embark on the wonderful, interesting world of surgery.
Space-based memory decay prevention study tool. And I'm a pretty big fan of it. I used to not be a biggest fan until I just took my destiny in my own hands, started making my own decks, my own cards. As you can see, here's my epic deck. I got a surgery deck. I got a OB deck, 2 OB decks, pain decks, psycho deck for psychiatry, and these are pretty much my family medicine deck. I got 234 cards due today. Through these, fasting-induced neuropathy, that's acute intermittent porphyria. Naltrexone has both effects. It's a pain drug right there. Is functioning impaired in bipolar 2? Not necessarily. Normal serum chloride, that's 96 to 106.
5 hours later.
Tremor type, that's a dystonic tremor. You see primary adrenalitis. Fibrinogen concentration in dick decreased. Painless intermenstrual bleeding, rule out endometrial polyp. All right, guys, here I am in the bathroom. As you can see, I don't like to waste any time. Dr. Goldman has got the bathroom set up with all these study materials. Like the great Beatles say, you get by with a little help from your friends. Yo, Matt! You the man. Thanks, dog. All right, guys, time out. The time is 6:35. We got Mr. Jake in the driver's seat. We got Mr. Matt riding shotgun. We're headed to UF Com, right on schedule, and keep you updated. We're riding in this Jeep, and you know,
Surgery Safari.
Surgery Safari. SVZ's in place.
Antibiotics are in.
Antibiotics are in. Let's go.
Here today with esteemed medical student, future surgeon Jesse Karen. Just going to ask him a little bit about how he got to the Wall of Fame and what it means for him to be among this list of such prestigious names.
How we doing, guys? As you can see, still day 1 of the documentary. This is my orientation class. You know, they're gossiping and doing stuff medical students do, but I'm here on the Wall of Fame already. I'm really honored that you guys nominated me for this. I wasn't expecting it. I didn't prepare a speech or anything, but thank you guys so much, and I'll just be on this Wall of Fame for the foreseeable future.
In our first day of orientation, My fellow medical students and I were taught the basics of proper surgical technique, including instrument tie, surgeon's knot, the one-handed knot, the two-handed knot, the vertical mattress suture, the horizontal mattress suture, and many more. This was our last chance to hone our skills before we were thrown to the sharks the next day. The next day I headed to Jacksonville, where I would start my surgery rotation with my 1-week elective in urology.
Welcome to the Jacksonville Department of Surgery. It is time to begin our rotation. We are in day 2. Hello. How are you? How we doing, guys? It is day 2 in surgery. Just did some Eurosurgery today. Just clinic, actually. Pretty light day for me. No OR action today. But this guy, he's seen a lot of OR action. My boy, Danny Boy, the Borscht maker. Then we got the ortho bro, Keegan, working on his core. And you know, we got MG working on his hand-eye coordination always. Working on that cranial nerve 3, 4, 5, and 6. Or I guess just 3, 4, and 6. All right, guys, we got to get back to work because we're in surgery rotation and we're very busy. See you guys tomorrow. Good morning, guys. It's about 4:24 a.m. The date's October 27th. I am just saying good morning to you guys. Here's my room. It's a bit messy now. Still kind of getting reorganized after my new surgery transfer rotation. Let me bring you to the schedule over here. So looks like I will be starting some practice questions soon, followed by some ONCU/OR time. I got a nephrectomy starting at actually 8:30. Resident told me to be there at 6:30. So instead of twiddling my thumbs for 2 hours, I will be doing some ONCU on my phone. Got a run later today in the beautiful Jacksonville skyline. Looks like I need to organize my room and play my guitar as well for what they call wellness. Yeah, I could use some organization for sure. So I'm gonna get in my SCDs here in my other bed. I have 3 beds. They gave me my room to myself because I guess my classmates, don't want a room with me because I'm a little messy, but that's okay. All right, guys. So I will see you in a few hours probably. Peep the OR in my room. Coming to you live, guys. I just had to sprint back to the dorm because I forgot my white coat, but now I'm white coat fitted. Let's see, I was timing how long that took me. 6 minutes, so I'm technically 6 minutes late, even though I was 7 minutes early. So not the great first impression, but it's my 1-week elective, so it's all about just having fun, right? See you guys. How we doing, guys? Nephrectomy went very well, and it's time for a genital reconstructive surgery. Catch it on the other side. How we doing, everybody? It is a beautiful afternoon. Genital reconstruction surgery. Actually, it was a reproductive organ reconstructive surgery. Went fantastic. And it's time for my afternoon run in a beautiful Jacksonville, sometimes mistaken as a not beautiful city. But the poor medical students, they just never leave the dorm. If you leave the dorm, you will see the beautiful sights, scenes, and sounds. I'll keep you guys updated. Here it is, folks. The Jacksonville Bridge. One of the most famous bridges in all of Jacksonville. Secondary to the Jacksonville Jaguars Bridge down yonder. I mean, look at this, guys. And then London Bridge is over there. Beautiful bridges in Jacksonville. Beautiful town, city. I think I see a dolphin right there. Show me that dolphin. There it is. You see that dolphin? There's a dolphin. Look at it. Look at this dolphin. Look at this. Look at these shots, guys. I mean, we got dolphins, and it's a beautiful, beautiful city. Look at that! Look at that! You just look at that. Dun 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 dun. Flying high now, gonna fly now, flying high. Young Jacks. How we doing, guys? Never walk alone. Just finished my 1.5 hour study session with my SCDs on to increase cerebral blood flow. And I actually got a day off today, but surgery rule number 147 states no days off. So I'm gonna be putting in work this morning, practicing my suturing skills at my home OR in the dorms. So wish me luck.
You didn't pull it through.
No, I'm pulling through.
Oh my God.
No, the mistake was with my flicking man was this.
Ow.
That is the that's the
your
only
post.
thing you can
Your post never moves.
Exactly. Post doesn't move.
In my second week of surgery rotation, I embarked on a 2-week elective in orthopedics. Here I am pictured in a hazmat suit, assisting in a hip replacement surgery.
How we doing, guys? Time is 5:52 a.m. And as the great Beatles once put it, you get by with a little help from your friends. So here's my friend, fellow neurologist, always studying basically electrochemical signaling. And I mean, one of these are basically just a big myelinated axon. And we're gonna connect basically a power generator to an afferent synapse. And we're gonna try to get MG home. If not, he'll just ride with me because, you know, we're always going to the same place. Stay tuned.
The SIMS lab is where medical students come to practice their laparoscopic techniques. Here at UFCOM, students are trained early and often in order to become next level leaders in their laparoscopic fields. Medical student Liddy Delivedero wants to become a urologist when she grows up. Here you can see her practically cutting the ureter by mistake because she is a new trainee. Margarita Ann wants to be an obstetrics and gynecology expert when she ages. Here you can see her cutting out a fallopian tube. Roni Ronigan wants to be a pasta maker when he grows up. As you can see, he's making a rigatoni. Ronnie Rigatoni is making some pasta. Not yourself when you're hungry? Think it over with a Snickers bar. Hey guys, trauma was just called in. The trauma medical student can't be found, so I'm gonna go look for her because we got a trauma. So let's go find her. Trauma! 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 Go to my documentary. Better look good. Trauma! Alright guys, so right now we're looking at the Sims. We're just looking at our fellow classmates about to go examine this fake patient.
Hi, Victoria. Hi, my name is Morgan. This is the surgery team coming down to evaluate. We're having abdominal pain. Can you tell me where?
Hey guys, just tuning in for the night. It's about 10 o'clock, way past my bedtime. Usually try to hit the bed by 9 o'clock p.m. That's 2100 hours. But tonight you guys can be in my room. Here we go, Keegs over here. Looks like he's brushing his teeth. He's an orthopod. You know, he's always pretty much like working out his muscles, brushing his teeth, shining his teeth. Then we got the Bacchus effect right here in full effect. Look at him. He's a urologist by training. Look at that guy. He's just, look, he's always grinding. That's the thing. Look at that. Anki on the phone. In his own sleep. Yeah, so these are my roomies, you know. So yeah, we're all pretty tired doing surgery all day, but it's time we go to sleep now. Good morning, everybody. The date is November 12th, 2021. Approximately 2 months and 9 days ago, and about 5 hours ago, my dad died of metastatic melanoma. That was diagnosed only 1 week previously after basically a 6-week demise. And today I've kind of rearranged my schedule to be able to assist in a melanoma surgery at 13:45, so 1:45 p.m. today on the November 12th. And this one is personal, it's for my dad, and everything I do is for my dad. This whole documentary, my whole life pretty much. So I'll keep you guys updated. How we doing, guys? Melanoma surgery went very good. My dad was watching down on me, making funny, inappropriate comments as we did the surgery. And now the news is covering it, and I'm headed back to Gainesville.
After my 2 weeks in orthopedics, I was on to my next surgical adventure, a 1-week fellowship in trauma. I was very much looking forward to this week in trauma. Here I am pictured enjoying a hot bowl of borscht while my friend and colleague Matt Goldman works on his baseball stitches.
Alright, you know what I'm flipping, right? See, I flipped wrong. Flipped right now. I'm gonna have to go left-handed. Gotta know both hands. Both hands. Very important. Bam.
Okay.
Guys, how we doing? Trauma week is officially here. Had my first little mini shift today. Tomorrow I got the 24-hour shift. What better thing to do on a 24-hour trauma shift than do a 24-hour fast? So right now, I'm finishing up my last meal, which is some cereal borscht. And then I will start the timer on my watch for a 24-hour fast and eat tomorrow night at 8:30, or maybe I'll just go for 48. We'll see. So I'll see you when I start the timer. All right, guys, borscht is complete. Officially starting my timer in 3, 2, 1. All right. Only 23 hours, 59 minutes, and 55 seconds left. Call it again. Until then, I'll be doing the trauma shift when I wake up. See you guys then. How we doing, everybody? It is November 16th. It's a Tuesday, and it is Trauma Tuesday. 24-hour, baby. 24-hour Trauma Tuesday. Let's get that initiated in T-minus 15 minutes. 6 a.m. on the 16th to 6 a.m. on the 17th equals 24 hours. How long have I been fasting for? 8 hours and 30 minutes since last night. I'll continue to fast throughout the 24 hours. Try to go the whole 24 hours. I think I can probably do it because of my fasting experience, but I don't recommend this at home, especially if it's your first 24-hour fast / 24-hour trauma shift. See you guys in the hospital. How we doing, guys? Just chilling in the call room right now. Where's the call room? No traumas right now. Let's check the pager. Pager says no trauma, so we're sending this M&M, working out the old brain. Okay. Time 7:48. How we doing, guys? Yeah, the distal pancreaduodenographioscopy. I had to leave midway through because I'm late to small group. Shout out to Dr. D. She's going to be on my YouTube channel today, so you guys will see small group and how we learn in the surgical field.
In small group, medical students met weekly to go over their week and also practice clinical scenarios that would be tested on the oral exam at the end of the course. Our small group leader was a Department of Surgery renowned physician, Dr. Deladisma.
This is the practice oral exam, week 4. Matt Goldman candidate up. Okay, pretend I'm not here.
So, 43-year-old woman presents to the emergency department with...
My differential is biliary colic versus cholelithiasis, but she doesn't really have any kind of fever.
That's how medical students take notes.
Jesse.
That's amazing.
I hope you keep all these papers.
54-year-old man comes to the ED once again.
All right. First things first, I want to check his
airway, then I want to assess him for breathing, circulation, followed by basically disability and exposure. Because I'm going to treat this first.
So you're examining him, and all of a sudden he vomits like a ton of blood. What are we gonna do now?
Well, based off his NSAID use, I'm suspecting like a peptic ulcer, disease, but also other things could be like gastritis. This is actually so high. Like we could show the next rotation disc to like practice. Like this is so high yield, I think.
No.
Are these mystery chairs?
I don't know, but I don't know how long they've been here. That's the thing.
They definitely look fresh. They're oily.
The bag is oily.
Yeah.
I mean, you can always try them. I don't know.
Oh, those are so new.
Really? Really?
These were here today.
Any recent vomiting episodes? You mentioned the nausea, but
No, not really. Not a whole lot. Not really vomiting. Just kind of like doesn't feel real well. Just kind of.
okay.
Howdy guys, how we doing? It is 8:40 about. Just hit my 24-hour fast mark, and I'll show you how to break a fast if you're gonna break it. Drink about 50 cartons of milk. Great way to break a fast. Just kidding. That'll give you diarrhea. Smarter option would be to maybe, start with banana, but watch out for hyperkalemia. Cereal, as long as it doesn't have too much sugar. But I'm gonna keep pushing myself. Maybe I'll break fast after a gym workout in the old residence gym. All right, signing off. Back to #Trump. How we doing, guys? Coming at you live from the OR. No patients in here. No HIPAA violations, lawsuits pending. So let me show you around. It's the table where you put the patient. It's all the cool lights. This is the anesthesia domain. All the anesthesia drugs and stuff like that for analgesia and anesthesia, that is. Here's a picture of Elvis. Not sure why that's there. It's where I write my name. It's where I keep my gloves. And this is where the surgery happens. Stand here, don't let your hands drop, or you'll get in big trouble. And yeah, it's where basically the nurse runs the show. Sutures over there. This is the OR. It's 8:54 p.m. Here outside the CT room, got a 6 gunshot to the abdomen, and I'm the platelet guy and the blood product guy, so I'm just watching the cart, make sure nobody runs away with the red blood cells. Headed back to floor 8 to check on the gunshot wound victim. almost 27 hours into my fast, feel absolutely fantastic. God. Deep into ketosis, and that's why I'm taking the stairs. Energy and cognitive clarity thanks to my fast. Trauma. All right, guys, it's only 1:30 a.m. and the residents, for about the last 2 hours, they kept telling me, go home, man, enjoy your life, go home, we're letting you go home. And I kept saying, no, never give up. But, eventually they were getting annoyed with me, so I just decided to leave. I'm gonna go home and break fast. It's been now 29-hour fast, which for me is like probably the 7th longest fast I ever did. Fasting brag, but thanks for following me on this. Not even really 24-hour journey. Well, I guess 24-hour fasting journey, not 24-hour trauma journey. But again, trauma's awesome. Shout out to all my trauma guys out there, and girls, and anybody in between. All right, guys, let me show you how basically break fast in Jacksonville. Compliments of the grill. Compliments of buy one, get 2 free.
Salads, should pour that in there. Conservative measurement of about 8 grams. And add the cheese, it's like 30 milligrams per deciliter of cheese, and then just sort of smooth the salt, and then you just wash it up. And you do that, repeat 2 or 3 times, and then just eat it, and that's how you break fast. But I always like to start with the buy one, see it, my Zayton conference over there. Shout out to Life Challenge, you know who you are. Sprint Challenge.
How we doing, guys? It is my last day in Jacksonville, and what better way to spend the last day in Jacksonville than with my mentor, Dr. Deldisma. Shout out to Dr. Deldisma. So I had just a meeting, so I'm a little late, but I'm gonna try to get into the second breast cancer surgery. So I'm very excited to practice some surgical skills that I've been practicing. This is UF North. hospital. Florida's not a bad place to train. Look at that. Look at that. The date is November 19th. And it doesn't get much better than that, folks.
After my 1 month in Jacksonville, where I trained in urology, orthopedics, trauma, and general surgery, I was back to Gainesville, where I would finish my surgical rotation with a 1 month core in acute care surgery. Here I am pictured in downtown Gainesville, enjoying a sunny Veterans Day with my acute care surgery partner, Margarita Ann.
I'm putting this on my dock. How are we doing, guys? Great day of clinic. Me and Margaret Ann just putting in extra hours, writing some notes. Time's 4:48. We got a sign off at 6 p.m. I'm still fasting. How we doing today, guys? I'm in between cases in my car. Dude, where's my car? My car is also a bed because I found a therapeutic mattress in the dumpster a couple months back. And I slept on it for a while, but then I was like, this therapeutic mattress is kind of overrated. So I put it in my car. And now I can just get a nice break in between cases. Just did a inguinal hernia repair. Next up, we got a perianal abscess. So just going to be chilling until then. How we doing, guys? Cholecystectomy in 28 minutes. Just enjoying a nice late lunch. How we doing, guys? This is pre-cholecystectomy. Morning, everybody. It's the day before Thanksgiving. Just picking up Margaret Ann to go to school / work. Time is 5:08 a.m. Margaret Ann eats herself a hearty breakfast every morning to fuel her body and mind for the rest of the day. We also listen to jazz every morning. How we doing, guys? It's 5:13 p.m. November 29th, week before Thanksgiving. Just waiting for sign out at 6 p.m. Just wanted to show you guys an amazing view from the 10th floor of South Tower Shades Hospital. What a blessed view. I just like to get my workout in during the day, so when I get home I can just chill. So that consists of climbing to floor 10 6 times in a row. Elevator down though, don't need the impaction of my L5 S1 vertebrae. All right, guys, keep it cool. Trauma. Well, guys, my adrenaline is officially pumping. I just took the trauma from the ER, multiple stab wounds to the abdomen, chest, left axillary area, and back. So basically, we assessed the airway, breathing circulation, neurological derangement. We found basically hemothorax, placed a chest tube, did a fast scan, then did a CT scan, then bam, to the OR, did an X-lap. And it actually went well, no free blood. And guess who got to do the closures? My adrenaline's just pumping. General surgery, definitely higher on my differential now. I think 73% of me wants to go in general surgery residency. It's gonna be hard to beat. How we doing, guys? Just got out of the OR where we resected the jejunum, my favorite body part. It's a huge day for me. The jejunum has been my favorite body part since I discovered it. And the resident turns to me and he goes, "Hey, you wanna be a surgeon?" And I go, "Yeah, I wanna be a surgeon." And he goes, "Go measure that jejunum." Hey, Uber, stop. Here's my Uber driver. Just found him on the side of the road. Hey, Uber, I'm going to the house of Margarita Ann for a snack.
I'm looking for Nature Man.
That's me. Dr. Nature Man to you, Uber man. Now I got a dog too. How we doing, guys? Coming from a trauma, exploratory laparotomy with a iliacal fracture, splenic rupture, and degloving injury, which I'm not sure what that means yet, but it's It's more serious than when your glove falls out, let me tell you that. And stay hydrated. Now, gonna go hit the books and be back tomorrow.
Too.
I don't even need all my figures.
Go straight needle. It's
I have to do my right hand.
yeah. See your surgeon's not
I have to
seen
do
it.
my right hand.
I'm still filming, Jesse. Is that okay?
Yeah, that's okay. Get my good side. Yeah.
That's it.
Oh, Jesse, that's beautiful.
I have an unorthodox style. I train in China, all over China.
Let me see.
This is drunken style, not time.
Okay, now.
Your needle is flying around. You gotta protect that needle.
Oh, patient just fell down.
Yeah, rips him.
I'll pick you up, patient. Needle driver. Needle driver. Scrubs around here. This is how you protect the needle. Oh,
What
here you
the
go.
hell?
Needle protected. How we doing, guys? Last day of surgery rotation. And about getting ready to place a gastrotomy tube for placement of enteral nutrition. You know, it was an awesome rotation, and I'll be back, planned or unplanned. So guys, one of my favorite parts of the OR is the music that they bump, intra-op. So right now, for this G-tube, looks like we are listening to some YouTube playlist of 90s punk rock, which is cool. You know, I like punk rock a lot. It's awesome. But what I like even more is listening to my own compositions. Just chilling like a rugrat. I'm gonna put this on. Turn the music all the way up. This is my 2012 hit single. It has over 2,000 views.
On our last day of surgery rotation, medical students met with faculty for a debriefing meeting to give our comments, feedback, and overall impression of the surgical rotation. Here were my thoughts.
I would like to say best rotation ever, in my opinion, because I have 3 reasons why. How we doing, guys and girls? It's December 18th, and I'm headed to MA's house to take the test, the NBME shelf surgery exam, the hardest exam one possibly can take in their life. You know, I'm pretty nervous about it. It only decides the rest of my life, but I'm gonna just give it all I got, not give up, and try to take some deep breaths and stay hydrated during the exam. And yeah, guys, thanks for watching my documentary about my surgical rotation. I love your feedback and suggestions for future videos. Up next, pediatrics. See you guys.
Never give up!